exercises I recommend to my patients when it comes to their cervical spine, their neck being straight or having reversal of the curve, are what I'm about to show you here. Now, bear in mind that the first thing you want to always look into is, why is your neck curvature decreased or straight? That is always the case. No matter what you're doing, you need to find out what it is you're doing that's causing it, so you stop doing it. But the one exercise that, basically all of these exercises are developmental exercises like DNS, dynamic neuromuscular stabilization, which is what we've all done as babies. One of the first ones that I really like is what we call Superman, Superwoman, only there is a variation of it because you're not using the exercise ball. And the whole goal of it is to activate the portion of your brain called PMRF, pontomedullary reticular formation, which is a part of your brain that basically says upright against gravity. Upright against gravity for the neck does not mean straight neck. It means that innate lordotic curvature, that curvature that your neck needs to have, which is similar to the curvature in your lower back. So it's going to look like this. You're going to be on your forehead. I'd like to have my arms by my side, my thumb sticking out and touching my butt, my shoulder blade, my shoulders rolled forward. So I want to activate my shoulder blades to gently pull it up. I'm not squeezing it up. I'm simply lifting and rotating it up. I go from my forehead, my head up, and then my neck up and a little bit higher. Don't squeeze your butt. You should not feel your lower back. You want to breathe biologically. Push your tummy into your the floor, which is what biological breathing would have done. Your chest bone right here is on the ground, and you are simply looking up, lifting the neck up, arms up, and you hold it. Make sure you don't squeeze your butt. This is one exercise. How often do you do it? I never ever tell my patients how many reps and sets they need to do, and the reason for that is because what matters is the form. If I tell you 2 sets of 12, and by the time you do the first set and you're at number 4 and you get tired and you lose your form, that means you did more wrong than right. So commit to the form and not to the reps and sets. The other exercise is what you did at age about 3 months, late 3 months. So you're going to be in that same position, bringing your hands down under your shoulders. You're going from the outside pinky side to the index fingers. You're pushing the ground away, meaning as if your hand's going to slide, but because there is a downward force into it, it is going to stay on. So you go from outside pinky side, your pisiform to your index finger. Your head lifts up, your neck glides up, you're pushing up, and you are lifting. This is not a push-up. You're not dropping your pelvis down, you're holding that end up. You're looking up and gliding up, shoulder blades down towards your back pocket, and you're holding it. Now, this exercise will allow your neck curvature to be closer to what it needs to be. When it's straight, that means it's not enough curve. When it's reversed, that means you have more of the opposite curvature. So it is a good idea to put yourself in a position where every part of your body is doing its part, so the part that's lacking its performance has a better opportunity to be closer to where it needs to be. Finally, the next exercise, I'm going to show you seated, but you're going to stand up. And what you want to do is, I call this praise the sun. So you're looking up, opening your arms up, and holding that pose. This also activates your PMRF, or pontomedullary reticular formation, which is a postural neurology tip that activates your brain into an upright position. Upright position allows your whole body to be closer to that ideal place, and that will therefore allow your neck to be in that place, the right place better. You have to understand that when we isolate a muscle or an area and we try to work out that area, we're really not doing much to the whole body, because that body part is not isolated from the rest of you. It has to learn how to perform with the rest of the body. So ideally, you want to give the task back to your body parts, ask them to perform their task and not do someone else's task or another body part task. And by doing that, we are producing in action positive neuroplasticity, positive performance of your whole body working together and doing their own job right. I hope this made sense. Make sure you subscribe. Make sure you have any questions. Contact me. And until next time, take care.